Hello, this is Bonnie Strickland, and I just completed 90 hours of my Women's Health Rotation this summer for the FNP program with Dr. Nikolai in Gunnison, Colorado. And the patient I'm going to talk about today is a 47-year-old Caucasian female who presented for her annual Well Woman exam, and she was having some premenstrual symptoms as well. She stated she had been experiencing symptoms of insomnia, anxiety, and nervousness 5 days prior to menses until day 1 or 2 of her period. She stated her symptoms were not present every day of the month. She also stated she has TMJ pain prior to menses that has resolved with Xanax use during this time for the previous year. TMJ pain is also relieved with exercise during menses. Exercise partially relieves insomnia, anxiety, and nervousness, but not completely. Her medications that she's currently on include Xanax 0.25 milligram, 1 tab daily PRN for neurofacial pain related to menses, Valtrex PRN for oral herpes outbreaks, which she has had none of in the previous year, and calcium 1,000 milligrams and vitamin D 800 international units PO daily. She's allergic to penicillin. Her past medical history includes the TMJ neurofacial pain that flares up 5 days prior to menses that has been treated with Xanax. Her aunt and sister both had breast cancer. She denied any illnesses or surgeries over the previous year. Her obstetrical history includes Gravida 2, Para 1011, with 1 C-section for cephalopelvic disproportion and 1 miscarriage with a DNC, and those were her only 2 surgeries. She has a 28-day regular menstrual cycle that lasts about 5 days with regular flow. She lives with her husband and 5-year-old daughter and is a software engineer that works from home. She has been married for 17 years. She does Pilates 2 to 3 times a week for strength training and hikes about twice a week. She has been experiencing stress in her marriage and states that these symptoms that she's having have been affecting her home life. She complains of the insomnia, anxiety, and nervousness related to menses, TMJ pain related to menses, and she denies headache, blurry vision, nausea, vomiting, and depression. This 47-year-old well-nourished Caucasian female presents with an appropriate affect, alert and oriented ×4 for annual exam and concern about premenstrual symptoms. Her vital signs are within normal limits. Her integument is pink, warm, dry, with a small area of red, dry, scaly area over her sternum. She has multiple solar lentigens, 1 to 3 centimeters light brown over her both arms and legs. Her neck and thyroid are symmetrical with trachea midline. Her thyroid is soft, supple, with no nodules, tenderness, or enlargement, and she has no lymph nodes palpated. Her breasts have no chest wall deformity observed, a symmetrical shape, no dimpling noted, no skin changes. Nipples are erect bilaterally without inverted nipples or discharge that is spontaneous. Fibrocystic breast tissue is present bilaterally. Her lungs were clear bilaterally with no adventitious sounds noted. Her heart rate and rhythm were regular without ectopy. S1 and S2 were auscultated. No heaves, thrills, or lifts were noted. Her abdomen was a flat contour. No skin changes noted. Soft palpation with no masses or organomegaly noted. No tenderness, bowel sounds throughout. She had no lymphadenopathy in her neck, axilla, or groin. She had, on her external genitals, she had normal hair distribution over her mons pubis with no ulcers, lesions, edema, or erythema noted. Her Bartholin glands had no discharge, edema, masses, erythema, or pain present. Her Skene glands had no discharge, edema, masses, erythema, or pain present. Her urethral meatus was normal in size and location, with no prolapse, erythema, or tenderness. Her vagina was pink, with a moist mucosa and deep rugae, and her cervix was smooth pink and nulliparous appearing, with no cervical motion tenderness noted. Her uterus was midline at 8 centimeters, no masses palpated, and non-tender. And her head and nexa, no masses were palpated bilaterally, and she was non-tender bilaterally. She was diagnosed with premenstrual disorder. She was treated with Lexapro 10 milligrams PO daily starting day 14 after the first day of her menses until day 1 to 2 of her period. She may continue with Xanax as needed for her TMJ pain, but this use was discouraged as it is an addictive medication. Her education included that it may take 2 to 3 cycles for Lexapro to help control her symptoms, and she should keep a diary to monitor her response to treatment. She should follow up every 3 to 6 months until her symptoms are controlled. Premenstrual dysphoric disorder is related to hormone fluctuations of the menstrual cycle. Symptoms usually present during the luteal phase when progesterone and estrogen levels decrease. The symptoms are thought to be from an abnormal response to normal hormone changes. These hormonal fluctuations are thought to cause a change in the serotonin system. That is why SSRIs have been effective in treating this. So my strengths and weaknesses of my encounter. My women's health rotation this summer was a challenge for me because I did feel out of my comfort zone. The pelvic exam was more challenging than I anticipated, as the cervix can be located anteverted, retroverted, anaflexed, retroflexed, and sometimes can be difficult to find, especially depending on the size of the woman. However, by the end of my rotation, I felt much more comfortable with the exam. I also enjoyed having time in this rotation to discuss problems with women and to try to come to solutions to help improve their quality of life. The research article I chose was a review of many studies on the treatment of PMDD. 5 to 8% of women of childbearing age suffer from PMDD. Some of the symptoms my patient had overlapped with symptoms including anxiety, irritability, mood swings, and tension. The article had other non-pharmacological ideas I did not propose, but will in the future. They include regular aerobic exercise for 30 minutes, 3 to 4 times per week, avoiding stressful events leading up to the menstrual cycle, and establishing a regular sleep pattern. Dietary modifications include limiting salt, caffeine, chocolate, alcohol, and fat. Dietary supplements that may be beneficial include calcium, magnesium, vitamin 6, B6, tryptophan, and vitamin E. A randomized control study, so level 1 study, showed 40 drops of Vitex Agnes cactus per day for 6 days prior to menses over 6 consecutive cycles helped decrease the premenstrual symptoms of irritability, anger, mood swings, breastfeeding, and headaches compared to placebo. The literature supports the use of SSRIs with studies showing efficacy rates of 60 to 90% for active treatment versus 34 to 40% for placebo. This is good information to share with patients. The luteal phase dosing is desirable because it has decreased the side effects of decreased libido and weight gain. Cognitive behavior therapy has also been shown to be effective in adjunct to the SSRIs. If the luteal phase doesn't work, you can use the SSRIs every day. And if one doesn't work, you can switch to another. Thank you.